Ladies and gentlemen, good morning, good afternoon, good evening from wherever you are joining us today. You are welcome to this very special webinar series on scientific writing. This one is special both in terms of the presenters and in terms of the time. I know that this is the unusual time. Some people have called me within the week to ask if it was a mistake. It wasn't a mistake. This is because we are getting our resource persons from Japan who, by this time, it's already night for them. So they are making a great sacrifice being with us at this time. So you are welcome to this session on development of your method section of your manuscript. I'm going to take you through the ground rules. It's as usual. Oh my God, what is this? Sorry, please. Okay. Let's see. Yep. So before we start, I want to remind us that, as usual, this is a virtual training which adheres to the standard rules and codes of conduct to prevent harassment, including sexual harassment at all WHO events. You have opportunities to ask your questions, to use the Q&A. You have the Q&A button, which is provided for you to ask your questions on the presentation, on the topic of the presentation today. So all questions on the topic should go to the Q&A, which may be answered as the presentation goes on, or there will be live answer provided by the presenter later. Then you also have the chat button where you can chat to ask, to raise issues concerning the technicalities, the IT and logistic issues concerning this session. So the Q&A is for you to ask questions on the topic. The chat is for you to raise technical issues. We have simultaneous interpretation for this exercise. So we have interpretations in English, French, and Portuguese. So for you to avail yourself of this, just click on the interpretation button below your screen, which is like a globe. Then you choose the language in which you want to hear the presentation and in which you feel more confident. So you also, if you have opportunity to speak, you also feel free to speak in the language that you feel more comfortable with, because there's a simultaneous interpretation. Note please that the interpretation of proceedings serves to facilitate communication and does not constitute an authentic or verbatim record of the proceeding. Only the original speech will be considered authentic. Like I said, there's also going to be live transcription. So if you want to enjoy the live transcription, just click on the show button, show captions button, the button show captions, and this transcription will appear on your screen. To close that caption, click on hide captions. With respect to recordings, materials, and feedback, this session is being recorded and will take your attendance as a consent to be recorded. Recordings will be shared after this session only to those who registered for this session. The session materials, including session recording, will also be emailed to participants in today's and a couple of days following the webinar. As we continue to improve our training program, your feedback is invaluable to us. So we'll be sending a survey at the end of this session. We highly encourage you to share your thoughts and suggestions. Your input will help us to tailor future sessions to better meet your needs and expectations. So again, you are welcome again to today's seminar. I'll be introducing our resource persons as they are called upon to speak. So for the first speaker will be Kayano, Dr. Kayano Ryoma. Dr. Kayano Ryoma is a WHO staff based in the Kobe Center, WHO Kobe Center in Japan. He joined WHO after serving as assistant professor at Nagasaki, the famous Nagasaki University School of Medicine. You remember what Nagasaki is famous for. In his current role, he serves as the focal point of health emergencies and disaster risk management, health EDRM. He plays a crucial role in facilitating global research collaboration through the WHO thematic platform for health EDRM research network. As one of the lead editors, Dr. Kayano contributed significantly to the development of the WHO guidance on research methods for health EDRM. This is exactly the reason why we are bringing them up here, because today we are talking about methods. This document was published in 2021. He also leads global initiative aimed at promoting health EDRM research and translating research findings into policy and practice, including the dissemination of research method guidance. Drawing from his background in mental health, Dr. Kayano has led several research projects at the WHO Center in Kobe, WHO Kobe Center, focusing on mental health and cognitive decline. Additionally, during the COVID-19 pandemic, he coordinated research projects related to health EDRM in the context of COVID-19 and facilitated the exchange of information with local stakeholders. This short brief on Dr. Kayano has also been shared with you in your emails. I will now invite Dr. Kayano to take the floor.
Thank you.
I'll stop sharing.
Thank you very much, Dr. Joseph, for introduction of myself. Hello, good morning, good afternoon, good evening, everybody. My name is Ryoma Kayano, Technical Officer of WHO Center for Health Development, located in Kobe, Japan. That is why our center is called WHO Kobe Center, which was established as a symbol of recovery from a huge earthquake occurred in 1995. It was called as a Great Hanshin Awaji earthquake. So I'm a technical officer working for the WHO Kobe Center, in charge of the research on health emergency and disaster risk management. So let me share my screen first. So my part is introduction of this the webinar, mainly focusing on how to write the method part for the scientific paper, which will be presented by Dr. Shuhei Nomura, which I will introduce later. So first of all, my center, Kobe Center, is a policy research center of WHO headquarters, but located in Japan, as I mentioned, which was the outpost office of the WHO headquarters, because of the background of the establishment as a symbol of recovery from the earthquake. And we are doing some research on UHC, universal risk coverage, as well as health emergency and disaster risk management, health EDRM. We, WHO Kobe Center, is acting as the secretariat of WHO Health EDRM Research Network, which is a global researchers network to share information, knowledge, to improve the scientific evidence of health emergency disaster management effectively by the synthesized knowledge or promoting research collaboration among the international participants. Now we have the over 280 experts from 47 countries, and we have also 2 co-chairs as a representative of those experts from the over the world. One is from UK, Professor Virginia Murray, who is a very well-known researcher globally about disaster risk reduction arena, and also Mr. Jonathan Abraham from Australia, who also worked as a technical officer in WHO, who was leading the DLR activities for a long time. And the WHO Common Center is acting secretariat and facilitate global regional collaborative research and activities. And also organizing some webinars or workshops to promote research or provide the inputs or advice for the capacity building for research, how to promote research in your country, how to build a capacity on research in your country, utilizing some the WHO guidance. So recently, for example, last year, we organized the workshop webinar for the research capacity building in collaboration with the WHO Regional Office for Eastern Mediterranean and also WHO Regional Office for Europe. And following this webinar, we are now planning to organize the in-person workshop to promote research for countries in Euro and EMRO countries. And also, I'm discussing with my colleagues in AFRO or other regional offices the possible another workshop to promote research or capacity for research in health emergencies. Just one slide about the introduction of this seminar. Why research is important? Because health emergencies and disasters have always uncertainties due to nature of risk and lack of evidence. So because of the lack of evidence, we don't know what happens next. We don't know what should do next. So to answer those questions, we need very robust, reliable research or evidence. So that is why we need research. And to do good research, we need a good research method. That is why we developed this guidance in 2021 in collaboration with over 164 experts from 30 countries to develop kind of it's a very comprehensive guidance, how to plan, conduct, and report research in the context of before, during, after emergency and disasters. And we made updates on this in 2022 by adding one chapter on the how to apply this guidance in the context of COVID-19. And also on our website, the Virtual Common Center website, if you just visit our website, you can find those learning materials, which includes the slideshows and video lectures and podcasts and chapter summary, so which is very helpful for your learning. So this guidance consists of 7 sections: introduction section, the identifying, understanding the problem section, determining the scope of the study section, study design section, and special topics, and also COVID-19 related section, and how to become a researcher. It's a very comprehensive, huge 700-page document. However, with one by one, we talk about when we talk about the chapter, it's not such very huge, too much to read actually. But of course, it's each chapter deal with different topics. For example, in sections 2, we talk about the identifying and understanding the problems using the epidemiological principles, or the introduction of some data collection tool, or how to build the databases, or how to use the existing databases registers, or how to do the scoping, systematic reviews, how to system knowledge. Those kind of things are written in the section 2. Section 3 is much more talk about the research question, how to build the research questions, or how to consider the ethics of research. It's more about the beginning of the research. Then section 4 is a very specific methodology, like statistics, like advanced statistical techniques, or like the qualitative research, mixed methods, or natural experiments. Those specific research method is written in section 4. And in section 5, we talk about some special matters like disaster mental health, or refugees, internally displaced populations, or indigenous people. And we talk about how to apply this guidance in in the context of COVID-19 in the section 6. Yeah. In addition to this guidance, because as I mentioned, this is a very huge document, so we are now developing the shorter, the very more summarized documents for policymakers and you, WHO colleagues, and the practitioners, because it's too big for policymakers to read. So we are now preparing the very short summary of this guidance, why research is important, what kind of evidence we can obtain from each type of research. So these types of things are now we are preparing to move forward. And so Research Network is always open to everybody, and just read this QR code and send me an email. So my email address will be shared later by the organizer, and also this is always open to you. So visit our website and send me an email if you are interested to be a part of the Research Network. We are always happy to involve you, to work together with you, to share knowledge and promote research together for the better scientific evidence, for better protecting people from the emergency disasters. So that is the introduction of my introduction about this webinar, about the introduction of my center and the introduction of myself. And today, the Dr. Shuhei Nomura will provide the presentation about how to write method part of the scientific paper, which is the most important part, one of the most important parts of the research paper. And he is associate professor of Keio University School of Medicine, Japan, and he obtained a PhD in epidemiology and biostatistics from Imperial College London in 2019. And he's leading the COVID-19 excess mortality research team at Japan's Ministry of Health, Labor and Welfare. And also he is a scientific council member for the Global Burden of Disease Study, and also experts panel of the Global Nutrition Report. In 2023, he joined the G7 Hiroshima Summit's Global Health Task Force and became a member of the Executive Committee on Global Health and Human Security in Japan. So his expertise spans data science, global health policy, and crisis management in health and nutrition. So he has a broad expertise especially in terms of the statistics and the epidemiology or other the research areas. He also contributes to the development of the research method guidance also, a long partner of the Virtual Congress Center. And I'm very happy to invite him to provide the seminar about the paper writing on method parts. So now I would like to hand over to Dr. Shuhei Nomura for the floor. Thank you very much.
Thank you very much, Ryoma, for your kind introduction. And hello, everybody. I'm Shuhei Nomura from Keio University, Japan. So let me share my screen. Can you hear my voice and can you see my screen? Okay, good. So let me introduce myself again. I'm Shuhei Nomura. I'd like to thank the organizers, Afro and the Kobe Center, and everybody involved for giving me this super important opportunity. I do work in the field of data science, and today I'd like to share some insight on how to write academic papers. Especially, I want to focus on the method section. So just to give you a bit of background of myself, as kindly Ryoma mentioned that I do specialize in global health with a particular focus on creating evidence for the policy making. And I have been working with the Japanese government for many years on some projects, such as like the G7 Summit, G20 Summit, and also the most recently, we are now working on the agenda setting for next year's Nutrition Summit, which will be held in France. And when it comes to COVID-19, I am leading a research team under the Health Ministry that monitors the excess mortality of COVID-19. So I have written many papers, academic papers, mainly in public health and epidemiology. So my talk today will primarily focus on, how to write the papers in the field of public health and epidemiology. But the method section I will discuss today can be broadly applied to all health sciences, I hope. So I'm thinking of dividing my talk today into two main parts. The first one is I will start with the general explanation on how to write the method section. And then I will plan to go through some specific case studies. So first of all, the most important things to remember about writing a method section of the paper is that it is a very, very important process for sharing and validating scientific discoveries and insights, And here, I really want to emphasize the concept of replicability. So replicability is, whether other researchers can achieve the same result as you did by conducting the same research method. So this is a very, very important element of reliable science, especially in the field of medicine or health or public health or epidemiology. It is often required to use the research methods that can confirm replicability, in order to demonstrate that your research results are not just a product of chance, but they are reliable. So I can say, in other words, replicability is a kind of key for supporting scientific claims. So let's think about how we should go about writing a paper in the method section. It is very, very important to describe your experimental procedures and also your observational method in detail and clarity. And this ensures that everybody, the other researchers, can accurately replicate your study. So it is a very, very important foundation for your research to be respected within the scientific community. And when it comes to paper, the way you handle the data you have obtained from observations or experiment is very important key. So by clearly explaining how you cleaned your data, how you prepared your data for analysis, and also the statistical method you used, you can, significantly enhance the credibility of your research work and findings. And, statistics. Statistics are very important and powerful tool for backing up scientific discoveries. So detailing how you have used them is also super, super important for ensuring replicability. And if, a study cannot be replicated, its value is seriously questioned. So whether we are conducting a research or writing the papers, it is our responsibility as a scientist to always focus on replicability and provide a reliable scientific evidence. So, the writing a paper isn't just about reporting findings. It is all about providing information on how those results were obtained in a way that which allows other researchers to verify them. This is very important. So, okay, so next I would like to go into what should be included in the method section. So the first of all, research design. So research designs fall into two main categories: interventional studies and observational studies. And the very, very, very importantly, there are international guidelines for like each. The one is the consult statement for intervention studies, and another one is the Strobe statement for observational studies. And of course, there are also other guidelines for like the case studies, case report, or systematic reviews, meta-analysis, etc. But these guidelines are like rule book for conducting a research, showing what should be reported in your paper, especially method section. And I want to have a quick quiz. If you conducted this study, which reporting guidelines should you check? You can think about a few seconds. So it depends on study design, which you should look for. So basically, we have mainly two types, intervention studies or observational studies, and the corresponding guidelines are different. So the correct answer for this case is A. How about this one? You can think about a little bit in a few seconds. Or if you want, you can speak out or you can chat in the box. So the answer for this case study is B. Then you can check the consult guideline or Strobe guideline in their respective papers. And you can also download a checklist somewhere. And these are very, very important documents, which is why they are published simultaneously across the multiple journals. It is super, super rare occasions. Different journals publish the same paper. I have never seen other cases. So recently, a lot of journals have a rule where we needed to submit the checklist from these reporting guidelines along with your manuscript to the journal. It is a way to make sure that the information mentioned in the guidelines are properly reported in the paper. So, the classifying the research design is basically straightforward. So please refer to this flowchart. You can use this flowchart. For example, the randomized control trial are considered the gold standard of intervention studies, the better for assessing the effectiveness of treatment or interventions. And meanwhile, the cohort studies or the more popular, like the cross-sectional studies are great for exploring risk factors for specific diseases, etc. And it is very important to understand that, the necessary analysis method may depend on research design, but the kind of information you need to include and report in your paper is basically the same. So this is very important. So now let's talk about what information should be reported in your paper in the method section. First of all, your study population and study setting. It is very, very essential to describe who participated in your study and what criteria you need to select the participants, the exclusion criteria or inclusion criteria, and why you set those criteria. These are very important information you need to describe in the method section of the paper. So this also explains your data sources, which means where you got your data from. And you should also detail the location, environment, and also study period. The duration of your study. So having this information makes it easier to understand the context of your research, and also other researchers can replicate it under the similar conditions. I also would like to touch on ethical consideration. This is also super, super important to discuss how you protected the rights and the safety of the participants and how you obtained informed consent. And also whether you received appropriate approval from the ethical committee. So these steps are essential to ensure the ethical integrity of your research work. They need to be transparent, and well documented. And of course, if your study doesn't involve people, the human, or if your study was based on open data, then I do believe the ethical approval might not be necessary. So next up, statistical methods. So this part is directly related to how we interpret the result of your work, your research work. And it is essential to the detail of which statistical method you used and why you chose them, and also the version of the software you used for the analysis, which is also important. So having this information makes it easier to assess reliability of your result, and it also serves as a reference for other researchers conducting similar analysis. So, when writing the method section of a paper, it is not just about listing information. It is important to explain why this information is necessary and how it contributes to the reliability and also replicability, of course, of your research work. So by carefully describing your methodology, you can enhance the transparency of your work. For example, this is just an example. If you conducted a randomized control trial, you would include details about how participants were randomly assigned and also what interventions were carried out, etc. So this makes it easier to understand the specific process of your study, which allows for a deeper understanding of its value and the significance of your paper. So, okay, so let's go into discussing statistical method in detail. The statistical analysis influences the validity of your research work. So let's look at what point you should report in the paper in order to enhance the statistical selection of your study. So the first of, it is very important to clearly define all the variables used in your study. If you have continuous variable that need to be categorized, you should explain the rationale behind how you categorize them. And it is important to use clinically meaningful cutoff value. For example, regarding age, it is usually a continuous variable, but sometimes it is categorized into groups like older, the versus younger, etc. And in such cases, you need to clearly explain why you divided it into these two groups. And the cutoff can be at 65 years old or sometimes 75 years old. And you need to make sure to clarify them. And the definition and the measurement method of your study's outcome, which are also important. So if you choose an uncommon outcome, it is recommended to explain the logical reasoning behind this choice of the outcome. And this helps the readers understand the relevance between the study objective and its outcomes. So let's move on to missing data, which can be happening. So if there are the missing value in your research data, you need to clearly describe how you handle them, like how much data was missing for which variable, and how the missing varied depending on the presence or absence of any exposure factors. If you use the method like multiple imputation, this is a statistical technique, to deal with the missing value, you should explain everything, the method. And let's also touch on multi-variable regression analysis as a kind of example of a statistical method. It is, essential to state why you have chosen that specific regression model. Like, there are a bunch of statistical approach for regression, linear regression, logistic regression, Cox regression, etc. There are many. And also, what were the rationale behind the selection of independent variable included in the model? So you need to clarify everything in order to get replication. And when writing the method section, I cannot stress this enough, please focus on replicability. If you are not confident in your stats method, please consult with an expert of stats. So, the way you document the stats method plays a very important role in the credibility of your research work. So clear definitions of variable and appropriate handling method of missing data and the logical choice in stats approach. So, all contribute to the validity of your result, which makes it easier for readers to understand them. So please keep this point in mind when writing papers. Okay, so let's take a look at the example I get as a task from the Virtual Code Center, which focus on the cholera outbreaks. So once again, the key point here is, replicability. It is a very, very important point to explain all the necessary information so that somebody else can replicate the study. So first of all, let's think about the data sources and data collection method. It is important to specify where your data comes from, whether it is hospital records or the reports just from public health centers or agencies or the surveys from local communities, etc. And these are the various possible sources, and detailing which ones you have used is very, very important and necessary information. And sometimes you might also collect related data through questionnaires or interviews or surveys, etc. So make sure to include that information too. And don't forget to mention that data collection period, and also data collection frequency and timing, and also geographical scope of data collection. They are also important. And next is the definitions and the classifications of cholera cases. For example, it is very important to distinguish between suspected cases or confirmed cases. They are totally different, or sometimes the recovery cases can be used for the study. And data quality control, which is another important aspect. This includes like details, the accuracy of confirmed diagnosis, what tools were used for diagnosis, also the kind of sensitivity or the specificity, etc. And also if there are the missing data, like ages or genders, etc. You needed to explain why these missing occur is also necessary information. And regarding statistical analysis method, it is essential to specify whether you have used what technique, such as time series analysis or cluster analysis, etc. There are a bunch of analysis approach. You need to explain them. And also it is important to mention the statistical software or tools you used. And lastly, let's touch on ethical consideration, such as measures taken to protect the data privacy or confidentiality, etc. Okay, so I believe this point, of course, essential, but I'm not directly involved in data collection of cholera cases. So there might be additional necessary information. And the important note I would like to highlight here is the importance of collaborating with statistical experts or researchers. So when you have drafted a report or paper, getting a researcher to review your methodology is super, 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 super important. I always do this myself. I have published over 200 scientific papers, but I always have other researchers review the methods section to ensure replicability based on the information I drafted. Very important. And of course, I always follow reporting guidelines like Strobe or Consult. But even then, how detailed we should get really depends on the research situation and varies sometimes from person to person, editors to editor, peer reviewers to peer reviewers. So please don't hesitate to ask for a review from other researchers or me. I'm more than happy to help. And yeah, it's all about the making sure others can replicate your work based on the information you have provided. So just to say it again, what really matters is replicability. No matter what kind of data we are talking about, this is a very, very important key things. So like, for example, the data from reports related to the, IHR, International Health Regulations, like from joint external evaluations, JEE, or the after action reviews, or simulation exercises, etc. You are very familiar with them. So I believe it is clear what should be reported in the paper if you keep that in mind. Okay, so I want to go to some specific case studies, but if you have any questions, I can answer, or I can get some questions later. Okay,
Yeah,
so let's go to.
Go on, please.
Okay, thank you very much. So now let's go to specific case studies. Based on the nature of the data, I have prepared 3 case studies to explore. The first one involves research using government stuff. This is from a paper I published last year, the very recent paper, which investigated how the COVID-19 pandemic affected the location and the number of cancer deaths in Japan. So, as you know, the COVID pandemic had severely impacted health systems worldwide, and of course, including Japan. And there has been a decline in cancer screening rates in Japan, which raised a bunch of concerns about the potential increase in cancer mortality later. And as I mentioned earlier, I think I have been leading a research team under the health ministry to monitor the pandemic-related mortality, and this study was part of that effort. And our research team had 2 main objectives. The first one was to find out if cancer mortality has increased in Japan after the pandemic. And the second one was to see if there had been any changes in the places where people died from cancer. There have been some restrictions on visiting medical facilities during the pandemic in Japan, and some of which are still effective now. For example, the family members cannot freely visit patients in the hospital in Japan. Then many healthcare workers believe that terminally ill patient, like cancer patient in the later stage, prefer to spend the final moment at home rather than in hospitals. And we wanted to investigate this trend. So here is a quiz. What kind of data would you need for such a study? So please remember, everything in the method section of your paper must explain all the necessary information for replicability. Someone else should be able to conduct the same study based on this information provided in the method section. So what kind of data do you think is necessary for this study? You can think about it, or you can speak out, or you can chat on the box. This is super important process when you write a paper. You can imagine how other researchers can do the same study based on the information you provided. Given the replicability, you must carefully consider that. I can give you 10 seconds or 20 seconds or 30 seconds. You can think about that. That is the process when making a method section.
Well, you have some responses in the chat.
Okay.
We're talking of responses or questions.
Responses, he asked the question.
Health records.
Okay.
Hospital data, health record.
Yes,
That is a
please.
very important point.
Yes, please.
Yeah, thank you. So basically, I used the mortality data from the health government, but you needed to go into more details. Data is of course important, but what kind of data, especially like from when to when, or mortality data should include what information, also geographical location, etc. Okay, thank you, everybody. This registry, yes. Private sector facilities, that's correct. That is also important. Thank you very much. Yeah. So what data we used? So we used individual level data from the Japan's vital statistics, which we obtained from the health ministry. And the study period was until February 2023, using data from 2012. And we focused on all deaths in Japan, excluding those of travelers, in order to eliminate any biases from decreased international travel to Japan during the pandemic. And we also defined the cancer deaths according to the international standards, I mean ICD-10. And also we categorized death location into the major 3 locations, like by combining the hospital and clinic into the medical institutions, etc. So this kind of information must be explained in detail. Otherwise, other people cannot replicate your study. So in this paper, we describe them just like this. So, writing them down are not too hard. It is just about putting them in words. I want to skip the technical details of our stat method, but simply speaking, we used a quasi-Poisson regression to a kind of Poisson regression to predict the expected number of deaths that would have occurred without the pandemic. Then we compared this to the actual observed number of deaths, which defined the difference as excess mortality. So, and here's what we found. So after the pandemic started, deaths in medical institutions significantly decreased in Japan, but deaths at home sharply increased. So importantly, as of 2023, February, we didn't observe any overall increase in cancer mortality. Okay. So the next case study, I want to share an example of a study that involved primary data collection. And this study is related to 2011, the Fukushima nuclear disaster in Japan. And this examined how evacuation after the disaster affected the mortality rate among older people. So, well, the disaster was triggered by a big earthquake and a subsequent tsunami, which killed more than 16,000 people. And at that time, I was doing a volunteer work in the municipality very close to the nuclear power plant. And soon after the tsunami, the government issued evacuation order. And the Minamisoma city in the figure, and the Fukushima prefecture, which had about 70,000 people, the Minamisoma was one of the areas affected by these evacuation orders. So our research focus was on the evacuation of older people from nursing homes in the Minamisoma city. And, you might remember, because of the nuclear disaster and also power outage, the water cut off, disruption of any life infrastructure, all nursing homes in the area had to evacuate their residents to the facilities outside the prefecture. And some of these evacuations took more than 10 hours from the city, the very long distance. And here is a very important point. Within the month of evacuation, the many evacuees passed away at the new locations, new facilities. This nuclear disaster was unprecedented in the history of Japanese disaster, and an entire population had to evacuate such long distances. And in the context of radiation disaster, quick evacuation is prioritized, of course, which is outlined in Japanese guideline for nuclear disaster response. So then we conducted research work to learn important lessons for future disaster response. And the objective of this study was to estimate the mortality risk among the older people due to evacuation after the nuclear disaster. And importantly, in studies involving primary data collection and also analysis, explaining the context like this, what I mentioned, is very, very important, because the analysis tended to be very specific, region-specific, location-specific. So understanding the context of the data is super, super important for interpreting the result and discussing their representativeness. So this point is, all the information I just explained now needed to be documented, everything in the paper. So this is the tips for the writing the method section. And here is another quiz. Considering a study like this, what specific data do you think is necessary? Of course, the focus here is still on replicability. It is about ensuring that someone else can conduct the same study with the information provided in the paper. So you can think about what kind of data is important, what kind of data is necessary for this study, which is the same idea, what kind of information should be included in the method section. So you can think about that. Age, exactly. Age is very important. Otherwise, we cannot classify who are older people, etc. Gender is very important. Otherwise, we cannot see gender-specific difference of mortality after the disaster, after the evacuation, etc. Underlying condition, which is super important, which influence the survival of older people. Date of death, exactly. This is very important. Otherwise, we cannot make sure the age of death. Location, true. Location, yes. Any other information you needed to know? So now we have location data, date of death, age and gender. Do you
There's
think it is
profession.
enough to conduct it? Distance, yes.
There's also
Onset the condition.
profession.
Yes, great. Date of evacuation, this is super important in order to know how many days the people died after the evacuation. Yes, exposition. Yeah, that can be important medications. Yes. Arrival date of new location, this is super important. Mobility, comorbidities, they are very important. Time. Underlying health conditions. Especially for older people, underlying health condition is super important. Exactly. Thank you very much, everybody. So, this is the answer. Because the primary data involves various contexts, the paper needed to be detailed a lot of information in the method section. And firstly, our participants are the residents of nursing homes in Minamisoma City. And unfortunately, not all facilities could participate, and the participation rate was about 60%. And some reasons for the non-participation included the complete loss of residents due to the tsunami. Everybody was killed by tsunami, and also the data being washed away. And these details are important for the paper. You know, the participants were all people who had a residential card, residential records in the facilities over the past 5 years before the disaster. And this is specific to Japan because Japan has two main types of nursing homes based on the level of care needed. This information must be included. They are very important to be explained. And the data, the description involved detailing what information was collected about a resident. And many people mentioned that their definitions and also specifically focusing on evacuation-related information, which is very important for this study. And I think that nobody mentioned about the stats approach. This is definitely necessary for conducting the research work. So regarding stats analysis, it is quite specialized. So I want to skip the detail, but simply speaking, we set 3 outcomes: the number of deaths per unit of time, survival rates, and hazard ratio. The key to this study was the duration of stay in the facility, because there is a significant differences between dying after 1 day versus dying 5 years of residence. This is totally different. That's why the duration of stay in the facility is very important. So this type of study is also known as a time to event study. And importantly, I think I have repeated many times, it is a good idea to have a statistician write or review the methods section of your paper or report. So feel free to use me or other researchers for that. So regarding the result, quickly, the mortality rate significantly increased after evacuation with an adjusted mortality risk 2.88 times higher due to evacuation, super higher. And the graph on the left shows the survival rate trend with the red color indicating a post-evacuation. So you can see a sharp increase in the details. I mean, the mortality within the first month. And the findings also provide very important lesson. The quick evacuation, as I mentioned, prioritize in radiation-related disasters, as clearly stated in Japan's nuclear disaster guideline. But this study demonstrated that evacuation itself could pose a risk, especially for older people. And then the Japanese guideline have been revised to clearly mention that evacuation itself can be associated with health risks, especially for older people, which also emphasized the importance of proper preparation and the safe transportation of older people. Thank you. So finally, I want to talk about the study that used internet survey to gather its data. And this study aimed to understand the characteristics behind the people who initially hesitated, but eventually decided to get vaccinated against COVID-19. So, identifying factors that influenced their change of heart provides very important insight for strategies to encourage vaccination campaign for the hesitant people, So this study was conducted in 2022 during the early stage of the COVID-19 vaccination campaign in Japan. And this time, the promoting vaccination was very important, the key policy in addressing the pandemic. You know, as of 2022, 2 years ago already, you know, there are more than, 2 years ago, it has already 2 years after WHO declared pandemic in March 2020. And, you know, because we did not have effective treatment for COVID-19, so the vaccination was considered the most effective approach, important public health intervention in order to prevent and control COVID-19 pandemic. But, you know, the vaccine hesitancy is a major public health issue and a challenge. And understanding why people are reluctant to vaccinate is very important for the promoting vaccination. And then this study compared response from an initial survey on vaccination intentions conducted before the vaccine program started in 2021 with a follow-up survey in 2022, which asked if the respondent had indeed been vaccinated. So the aim of this study was to provide insight into the reversal of vaccine hesitancy from not wanting to get vaccinated. So here is another quiz, the final quiz. What specific information would be necessary for conducting such a study? Again and again. So the key point is replicability. It is super important to detail all the information needed for somebody else to replicate the study. So you can think about what kind of data you need to replicate your study. What do you think? So you are the primary investigator to conduct the same study in your location, in your country, in your region, etc. Age group is important, gender, demographic data, location, paired data of individual answers. This is very important point. We follow the same individual to know who reversed their idea of getting vaccination. Reason for change of mind. That is super important. Otherwise, we could not go into the details why people changed their mind. Source of information, true. This is super important information that influence the change of the heart, like social media, government source, or the doctors, or the Yahoo, Google, etc. The profession, gender. Level of education, which is very important demographic information, which is known to be associated with vaccine hesitancy. Socio-economic level, income level, etc., which is influential for the decision to get vaccinated. Economic status, true. The vaccine choice, which is very important, but unfortunately, Japan has only one or two choices of vaccination. Social behavior, true. The masking and social distancing measure, the preference to choose such kind of the behavior also influence vaccine behavior. The belief, it is super important, the kind of trustful to the government, trustfulness in the vaccination, etc. Exactly, attitude to the healthcare workers, which is also related to trust in the healthcare workers. Marital status is also known to be sometimes associated with the behavior, the health behavior. The marginal group, this is super important. Health-seeking behavior, true. Thank you very much. So the time is approaching. The race is very important. The media influence, true. Okay, everybody is super familiar with this kind of study. Thank you very much. Exactly, that is very important kind of person. Like who are the family member, the number of the family, etc. Exactly. The history of cases of positive COVID-19 cases. Social network is super important. The local community leader often has the influence of getting vaccinated or not. Travelers, etc. Okay, so this is the answer. So there are a bunch of information needed to be explained in the paper in order to get replication of the study. Thank you very much. So, before the COVID-19 vaccines were made available to the general people, we conducted an initial survey on the vaccination intention of more than 30,000 Japanese people aged over 20. So this initial survey was done at the beginning of 2021, which was commissioned to a professional survey private company. And this company have its own panel of over 4 million Japanese people, which allows for large size survey in Japan. And the survey respondents get some points for completing surveys, which can be used for online shopping. So there was a financial incentive to answer the survey. And the sample size of about 3,000 would be good enough for the national representation, but we aimed for a larger sample size in order to allow for potential the prefecture level analysis, which was our original plan. That's why we collected the people, more than 30,000. And then the second follow-up survey was conducted about 6 months after the vaccination campaign, the program began, which asked if respondents had indeed been vaccinated. So these two surveys allowed us to see who among those initially hesitant had decided to get vaccinated within that 6-month period. And yeah, if there was a change in attitude toward vaccination, we also asked for the reasons why you have changed their mind. So based on many the previous research work and expert opinion on the vaccination, we prepared 31 the possible reasons for changing their intention to vaccinate and asked the respondent to choose all reasons that applied to them. Okay, so I cannot stress this enough, but all the information I have just explained needed to be reported in the method section of the paper. Without it, other people will not be able to replicate the study. And regarding the stats, so I want to skip, but simply speaking, we clustered the respondent who changed their minds about the vaccination, based on the answers to the 31 different questions. And we divided the analysis into 2 main groups, those who initially said no to vaccination and those who were unsure, hesitant. So this distinction was super important because refusal of vaccination and hesitation of vaccination represent totally different behavior. And importantly, I would recommend to have a statistician or me to write or review the method section of your paper. I'm more than happy to do. The final result for this cluster analysis on group 1, those who initially refused, but later get vaccinated. So this might be a little bit complex to you, but we found that respondents of group 1 could be broadly divided into 6 clusters based on the reason for changing their heart. And the left bar graph shows the number of people, and the right scatter plot represents the cluster based on responsive patterns, although this is super complex. So the one point, interesting findings was cluster 2, which had never been identified in previous research in other countries and might be unique to Japan. Super interesting. This cluster considered of people who initially didn't want to get vaccinated but did so because people around you got vaccinated. This is a kind of peer pressure. Okay, so thank you very much. In summary, so today's session focused on the importance of replicability in research work and how to write papers with this mind. So replicability means that another researchers can achieve the same result using the same methodology, This is a key element of reliable science. Then in order to ensure replicability, it is very important to detail every aspect of your methodology in the paper, such as the research design, participation, settings, statistical method, etc. This includes clearly defining all the variables and how they were handled and why specific analysis approach was chosen. So these details allow researchers and readers to judge the validity of the research work, the result of the study, and also enable other researchers to replicate that study. And importantly, please adhere to international reporting guidelines like CONSORT or STROBE, which enhance the transparency of your methodology, and also which also ensures that all the necessary information for replicability is provided. So, as our researchers, it is our role. And okay, so our role is not just to report result, but also we need to convincingly demonstrate how those results were obtained. Okay, so I hope today's session has highlighted the importance of replicability. Thank you very much.
Thank you so much. Thank you very much, Nomura, for this very participatory. I like the way you involve the participants in the process. So the message we get from here, colleagues, is that the method focuses on how replicable is your study. How replicable is it possible for somebody to follow the same steps and the same tracks you followed to arrive at the same conclusion? And that is exactly what defines the science part of your work. So if it is not possible to navigate through the same process, the same corridor, and arrive at the same answer, then your conclusions are not considered scientific. So in essence, therefore, in the method section, you have to be as detailed as possible in letting people know what exactly you did. The population, where you conducted the study, how did you define your analysis, and so on and so forth. So these are the things you need to put in your method section so that one can read and repeat your study and see if they can arrive at the same conclusion. So Nomura, please, if you don't mind, there are some questions in the question and answer box. I don't know if you want me to read them out for you or you want to go through them and try to respond to them. There are about 8 questions. Okay.
For
One of them-
non-English questions, can you translate to me?
Yes.
Okay. So let them translate to you. Okay, how do they maybe who is going to translate now? Maybe Ryoma is going to help us translate.
I just translated the French to English and it's in the chat.
Okay,
yes,
great.
okay, it's in the chat. Let me look for it in the chat.
There
The
are
French
two
to
questions.
English.
There are 2 questions in French. So this is the first one. I put another one as well also.
In the chat, okay. So
In
the
the
first
chat.
one, it says, for proportional hazard, it says for proportional hazard model, there are cases where the proportional risk assumption is not verified. What types or alternatives do you recommend to make the result interpretable?
That is very super technical questions. Maybe
Yes.
it's better to ask a statistician, but as far as I know, you can try like using a logistic regression and putting time variable into the independent variable.
Yeah.
So there are a bunch of ways to consider time to event analysis. Cox, the Cox other analysis is just a one approach. Logistic regression with time variable into dependent, also another option. And also there are the many approaches to do the time to event analysis.
Yes, so that takes us to the issue of time series analysis. So the second question is, what is your advice on how we can ensure the representativeness of a sample in the case of scientific article?
That is very important.
Mhm.
What I often do is to compare the sample population versus the national data, especially age distribution, sex distribution, education distribution. There are sometimes the country has the national data, and then we can compare such distribution with the data we have. For example, what we have done for the third case study, online survey, age distribution was a little bit biased for our study because our sample did not include the people less than 20 years old, because online survey can only apply to adult people. Children cannot answer. So by comparing such sample size data versus the so-called nationally representative data, sometimes the government have or large cohort study have, then you can see what kind of difference is happening to my data, etc.
Okay. Thank you very much. Another question says, thank you. In terms of statistical method, is it possible to provide us with some examples of types of regression to perform depending on the type of variable of interest? I don't know. Yeah, maybe we can address.
Thank you very much.
We can address this later with later communication. I don't know.
Right.
Or you want to try it?
So
Mhm.
yeah, there are a bunch of types of regression. Most, I think the popular one is linear regression,
Mhm.
which can be used for the continuous variable.
Mhm.
And also logistic regression, which can be used for binary outcome, like 1 or 0, yes or no, die or alive, etc. And also Poisson regression can be used for the outcome variable with a kind of discrete outcome or the score, like minimum score is 0, and somebody can have a score of 1 or 2, and somebody has 10 or 11. Such kind of a score can be used for the Poisson regression, etc. So it depends on outcome.
Yeah.
So if you are concerned about which statistical regression should be used or study, you can consult with the statistician. Well,
Yeah,
of
it
course,
depends.
I'm more than happy to do. Yeah,
It depends on the data set,
And-
actually.
exactly. And I believe recently ChatGPT can answer this kind of question very probably.
Okay. So I'm going to the question and answer box, please, colleagues. You say, I want to find out if cross-sectional study is applicable for this study, for this seminar. I want to find out if cross-sectional study is applicable for this seminar. Definitely.
Of course. The cross-sectional study is the kind of observational study. So my online survey, the last point, the last case study, can be a kind of the cross-section study.
Yeah.
Although we had a 2 time point, but first survey and second survey itself, they are cross-sectional.
Thank you. Then it says, where does systematic review belong? Interventional, observational, and guidelines to results. Yeah.
Good question. This is a different types of study.
Yeah.
And then maybe the Cochrane has a guideline, the reporting guideline for systematic review.
Okay, thank you. It says on replicability, maybe you would like to comment on the fact that it is specifically critical for quantitative research compared to qualitative research, where we mostly look for diversity, richness, and of understanding. I think these are 2 issues. Yeah. Anyway, go on.
Yeah. This is a very difficult point. So what I mentioned today in the session, in the seminar, is almost applicable to quantitative studies.
Yeah.
So maybe qualitative study should have other reporting guidelines.
In any case, I want to add, that's why I say these are 2 different issues. So to an extent, even though qualitative study looks at the range of opinion and views, that operate within
Yeah.
within a geographical location.
Mm.
And of course, these opinion and views change over time. I agree, definitely. But again, if somebody follows strictly the same process, methods, and within the same community and people of the same age range and cultural values, their values don't change so much. So what the whole essence of replicability is, you don't find out what is happening in Japan and report it as what is happening in Brazzaville. Meanwhile, another person follows your process, the same process you have reported in your method, and find that what you said you found in Brazzaville is totally out of place. It does not obtain in Brazzaville. So that is the level of replicability. So even as we are looking at range of ideas and views and opinion, there is still some element of replicability that can be recorded in qualitative data. Can we have some more questions are coming in French? I don't know. I don't know if they are among the ones I've taken before. It says, can we have idea of what kind of indication is for each method? I don't know. Yeah. I'm not sure I understand that question. Can we have idea of what kind of indication is for each method?
I think this question means like, in what kind of data, in what kind of situation, what sort of method we should use?
Yeah.
I can say it depends on study objective.
Mm-hmm.
So firstly, what kind of methods or statistical approach should be used are coming from study objectives.
Mm-hmm.
And then, yeah, if you have any statistical
Anyway, maybe
workers or
we'll try to address this in the response later. So it says, how can one come up with a novel study? There was too much emphasis on replicability. Do you want to take that first? I can take that, and my colleague Samuel can also come into that. So yeah, if you want to attend that. Mm-hmm.
I also want to know the answer to this question.
Okay, so the whole essence, like we said, science, what makes your enterprise scientific is that somebody follows the same method and arrives at the same conclusion as you did. And that is the whole thing about the replicability. So here we are talking of the method section of your study. So your method section must be so clearly presented so that somebody can follow it and come up with almost the same answer, the same conclusions you have, with very insignificant margin of error or difference. So that is why when you are talking of methods, you are in essence talking the buzzword for your method session is, can somebody understand this and repeat it? Can somebody understand it? And so that's why it looks like we're talking much about replicability. Samuel, can you also intervene here, please? Yeah.
Yeah, of course. So it's a really good question. And I think that exactly as the professor has suggested, what's really key is that someone could replicate the findings that you have had, given the descriptions and the detail that you've gone into in the methodology of your paper. So you can still begin with something original, and then even if someone could replicate that, that does not mean that the original study is not itself novel. It's also important to note that being very, very clear in your methods also means that if someone is not able to replicate your information, that you're able to identify why. So, for example, in some of the research that I've done in Sierra Leone, there are different findings depending on who you speak to in different parts of the country. So someone could say, hey, I found something that disagrees with your research findings, but if you have done due diligence in your methods to describe, but actually I collected my data in a different place or collected my data in a different way, which helps explain those kinds of differences. It also helps make sure that you're convincing the reader that you do have something that is truly unique, and that someone who has different findings that disagree with yours don't necessarily refute the findings that you've found.
Good. Thank you very much, Samuel. So
Thank you
there's
very
the
much.
question, they say, when the results finding, I think this is also important. We need to clear this. They say when the result finding differs, when the result findings differ despite the same methodology, what could be the issue? Nomura, do you want to take it first? Then
Yeah,
yeah.
I can say this often happens. Even if we follow the same methodology published by somebody else,
Mhm.
the result can be differences. And then our role as a scientist is to describe why that difference happens.
Mhm.
This is super, super important. For example, if, UK did a same study on vaccination hesitancy, and Japan, my research team, followed that study. We did the same methodology, but the result could be changing, could be different, because maybe the nature of the culture or attitude to vaccination can be different between countries. So we need to describe why that difference happened. The potential mechanism difference could be explained by blah, 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 etc. So we need to carefully describe the potential mechanism, the difference behind that. So that insight is very important to understand the country difference, etc.
Yeah. Yeah, that is one country difference. That's one. Then Sam, do you want to add some?
Sure. I mean,
Something.
I think that what's really sort of key is just to remember that, while we are all in some way, shape, or form, we're all scientists, but what we're not necessarily are mathematicians or physics PhDs. There's an element where we're dealing with human beings or animals or our environment. And so you're always going to find these differences between your field of study and perhaps what someone else has investigated at another time. And identifying those differences and explaining them exactly as has just been suggested is actually a really profound and important contribution that you're able to make in your own research. So not finding precise replication when someone's trying to use a similar methodology and so on and so forth, if anything, I think should be expected because we're dealing with these deeply human issues. And so I think that it's good to find those kinds of differences and then to really reflect on and read and learn and then articulate in your paper why you see the differences that you see, because that's probably really key to understanding the deeper issues related to the argument that you're trying to make.
Yeah. So thank you very much. So colleague that asked that question, and for everyone here, we are going to eventually this series, we are going to talk about discussion session. These are some of the things you bring into the discussion. And when you are doing your discussion, the question is, why do I believe your results and not another person's results? So this is where you have to explain the context of the country, like Nomura said, and what Sam is also enumerating. I'm sorry, there are so many. I think this topic is so important. I don't know. The questions are so many. They are just pouring in. I don't think we can take all of them because of time. There's even question on infodemic, but I don't think it falls within the province of this presentation. Let me just take one last one. You say, are longitudinal intervention studies considered observational studies? Can a STROP guideline use for reporting? Are longitudinal intervention studies considered observational studies? Yeah.
I do think so.
Yeah.
If there is no longitudinal intervention study.
Well, you can observe over time. You can observe over time, and then you do some kind of time series analysis of what you observe over time,
Mm.
So you may have multiple cross-sectional studies which run over time.
Yeah, I agree. It depends
Yeah.
on what kind of outcome would you like to focus
Exactly.
on, also what
Yeah.
kind of exposure variable you are interested
Exactly.
in. It depends on.
Yeah, depends on the exposure variable. I'm sorry, we are just running. My colleague Samuel, can you just go quickly and say what you are typing so that we just.
Sure, I was typing to the last question.
Yes.
Which was if someone can use the same method for different areas of study. And I was saying that absolutely, I mean, methodologies can be widely applied to multiple different areas of study.
Yes.
That doesn't mean that all methodologies will be applicable at all times, but there might even be multiple methodologies that could be used to examine the question that you have. So if you're not sure, a really, really good resource would be to speak with your peers and your friends, but also to look at similar historical studies in the literature base and to look at the kinds of methods that they use and to read very closely to understand the strengths and weaknesses of the findings that they had using and the analysis that they did using that particular method. So old literature, peers and colleagues are your best friend for finding out the best methodology to use.
Thank you very much. So on that note, colleagues, I want to draw a close to today's seminar. But before I do that, I want to quickly announce that on the 18th of March, we'll be meeting with the editors of Lancet. So they will be taking us through what they expect for us to write a good paper that can be considered in the Lancet group of publications, group of journals. And so that is what is going to happen next. Before we close, finally, I really want to thank our resource persons. I want to thank Ryoma Kayono for bringing this excellent presenter to us and for introducing us to the resources that are available in the WHO Kobe Center. Thank you very much. We are going to be exploring those resources. A number of them have been put in the chat. So if you're able to get them, you search them online. But then we have a more elaborate engagement with WKC in the near future. Then we'll be looking at, because what we are doing now, we just want to garner the data you have and get them published now. But then we want to move into how do you even collect this data systematically in a scientific manner. So we are going to be doing that series of seminar with WKC, jointly with WKC. So I want to thank Ryoma for this excellent presenter he brought to us and the resources that are available in WKC. I also want to thank Kato Makiko. She has been, can you please put your camera on, let my people see you briefly? She's also, she's working very closely with Ryoma, and she's been very fantastic in facilitating our meeting today. And my dear brother, Professor Nomura, I want to thank you most sincerely for the new slant you brought into our presentation today, the participatory method. And the participants have been very excited, and you can see the number of questions that have popped up. Thank you very much. I don't want to subject you to what we subjected Samuel to. When Samuel did his literature, we had to ask him to come back and do the literature again because there were so many demands. But like I said, we are going to have another series on methods, which will come after this series. So thank you very much. I also want to thank the interpreters for the good job they've done for us. My colleague Samuel, you are great. Amarachi, thank you very much. So thank you, colleagues. We continue next month. Thank you very much. Yeah, bye-bye.
Thank you very much.
Bye-bye. Of course, I thank the participants for their participation. Very active participation. Yeah.
Bye-bye, Prof.
Bye-bye.
Bye, Samuel.